I always wondered how people could turn their pain into happiness because I was born missing part of my back, part of L4 and L5, and had chronic pain as a kid. I read a lot. I kept reading about a physician in Phoenix called the Wizard of Phoenix who had polio as a teenager, was supposed to die as a teenager. He was 75 at the time. And so I wrote to him. I asked him about training. I was fortunate enough to spend 4 years training with him. His only requirement was that I get a medical degree or a PhD in psychology, which I was willing to do, and I did. I did that in San Diego, so I moved from Boston to San Diego. Used to travel to Phoenix in the middle of the night because all I had was a motorcycle, and it would overheat during the day. At nighttime it was a little cooler, the air cooled. So I would get there and spend a few days. Started off as a student, became a patient because my mother got Lou Gehrig's disease while I was in graduate school. Terrible tragedy. And I also became a co-therapist because we would see people together after my few years of training with him. Helped me write my first book. I've written 14 now. And it got me a job at Kaiser Permanente in San Diego as a consultant, helping people that they called the high utilizers, the 20% of the members that used 80% of the services. They thought of me as the doctor of last resort, so they would send me the patients that weren't getting better. And I saw a lot of people. I was training people, seeing clients, families, therapists, physicians. And on the way, I had a patient that Dr. Felitti had seen, the co-principal investigator of what is now the world famous Adverse Childhood Experiences Study. And I told him about one of the patients that he sent to me that was trying to lose 150 pounds and had lost it, gained it back, lost it, gained it back 3 times. Everybody was perplexed. Part of the health appraisal, 50,000 patients a year, part of the weight loss program, helping lots of people. So how did this person actually get better? Well, they did 3 things. I'll tell you about those, but very simply stated, they healed and resolved their adverse childhood experiences of a relationship with their father that was filled with sexual difficulties and all kinds of emotional problems, psychological problems with the mother as well. And after going through all the processes of the mind-body healing that I learned from my back pain, she actually lost the weight, kept it off, went to see Dr. Felitti in a follow-up. He didn't even recognize her. She told him the story of working with me. She insisted that we meet. We did. We've been collaborating now for almost 35 years. I developed the treatment solutions for his Adverse Childhood Experiences study, which is looking at people's childhoods, answering 10 yes or no questions. And based on our childhoods, he's been able to predict things like why people overeat and then have trouble keeping the weight off. Connected to cancer, cardiovascular disease, autoimmune diseases, every imaginable medical, psychological, emotional problem, ACEs, adverse childhood experiences, have been correlated now with dozens of medical studies. It's now in 120 countries. So it's grown from that very small experience and really being pushed back. People weren't sure how this could be true. But once we found out how people were coping and what they'd been through and the traumas of childhood, and we had the treatment solutions, which was my responsibility to come up with self-directed treatment solutions we could train physicians, group facilitators, nurses, physicians' assistants, the doctors themselves, and it really helped developing that unconditional acceptance of your situation, having a catharsis, a letting go, a journaling. We discovered one of my techniques of journaling with your non-dominant hand to really let go because you want all that to become non-dominant. And then with your dominant hand journaling to get to your inner doctor. So how do we know it worked? Well, some great examples. One of the leading hospitals in San Diego, the chief medical officer who became the chief of the whole hospital, the CEO of the hospital, was doing great, feeling great, just a very healthy person, pregnant wife, couldn't be going better. got a diagnosis after a full exam that he had a terminal illness, and he basically fell apart. I knew him, and I said to him, this is impossible. I just saw you. You were doing great. What happened? He told me about the chart. I said, well, wait a minute. And then we did some work. He got to his inner doctor. The conviction of the illness led to the illness. The conviction of the cure, because in fact it was the wrong chart, led to the cure. He gained the weight back, looked great, felt great. Okay, another person, a fantastic NFL player, doing great, having all kinds of trouble in his family, falling apart, started playing terrible, got to his own inner coach, kicking better than he ever kicked in his life. Finally, the co-principal investigator of the ACE study had a stroke, was struggling with hiccups for days and weeks, couldn't get rid of them, going to get surgery, got to his inner doctor, hiccups completely went away.